All right, so here are a few corrective exercises for the trunk and spine. So this is the very important series of muscles because it connects your upper body to your lower body. Okay, and if you have any dysfunction in there, it can lead from things from like lower back issues to anywhere in like your mid spine and your upper spine, all the way down into like your hip flexors, even groin muscles, outer hip issues. So some of those muscles can be affected by having a dysfunctional kind of core or trunk. So I'm going to take you through a few different ranges of motion just to help you kind of identify and assess what's going on. But kind of remember that what we're really looking for here is range of motion asymmetries. Those are like the check engine lights for your body. It helps you understand, if you can remember ever taking your car to like O'Reilly's or AutoZone or something, and you can plug it into one of the computer systems there, and it gives the mechanic or whoever a little readout, and it says, oh, there's a cylinder misfire on cylinder number 1. It helps them kind of figure out like where do they need to look underneath the hood and figure out why is the engine not working correctly. So this is kind of that same thing, is that we need a diagnostic tool. That's one of the best things about MAT, is that it gives us that diagnostic system, so we can start to assess and see, okay, is this getting better? Is it staying the same, or is it getting worse? Okay, so here's a couple of ranges of motion. And range of motion is that tool for us. So you really need to pay attention and see what you feel when you do it. It should feel equal on left and right side, right? You have the same number of muscles on the left as you do on the right side. So just really pay attention to that as we go through some of these ranges of motion and some of these corrective exercises, okay? But again, this is more for the trunk, which can help and fix everything down into foot muscles, all the way up until neck muscles, but the primary areas are usually nearby, meaning that if you're working on some of these, hip and trunk issues, hopefully it'll help with some lower back stuff, maybe some hip, issues. But again, it can really chain all the way up to the top of your head and all the way down into your feet. So it can help with a lot of things, but just really pay attention to where you feel and find the biggest range of motion asymmetry. And that's where you kind of need to work first, okay? So one of the first ones that I do is just looking at some of the hip and trunk area. So essentially we're just kind of looking from anywhere here kind of down to like middle glute area. So those are the main muscles that we're kind of looking at, both side of the muscles, front of the muscles here, some of the lower back muscles as well. So one of the first ones that I do is I just try to stand here with my hands at my sides, and I just do a side bend. And I reach down and I try to feel, how far can I bring this right hand down the side of my right leg? And then I just come back up to center, and then I try to reach down to the other side. So right now, for me personally, this feels fairly even, left and right side, but we're just really trying to assess, all right, do they feel equal, or do I feel like a little more stuck going one way or the other, okay? So if you feel that little sticky point, that's an area to kind of write down or remember, okay? So if, for example, you went to this, left side, my left side, and you're like, oh, wow, can't lean as far that way as I can when I go this way. And again, I'm exaggerating on that, but what that means is that there's something here on these left oblique muscles that may not be engaging. And so we have to look at how to engage these left obliques, because these muscles here along your side ribs, those contract to pull you that way. Okay, so those should contract. It's not just your obliques. There's lats. You have some lateral ab muscles here. You even have some side hip and glute muscles that work to do that, okay? The other thing to check for is watch your hips, okay? So if you're really having to shift your hips way over here to get to that side bend, that's a compensation, especially if you don't have to do that when you go to this side. So if this side looks like this, when you go this side, you're like, oh, my hips drop, and then I have all the weight on my right leg. That's a compensation pattern, okay? So that's one just kind of look at and address, and this can be one of the first exercises, is basically just gently trying to even that out. You should feel a contraction somewhere here on this side when I go this way, and you should feel some contractions here on this left side when I go to the left. So again, about 2 to 3 sets, trying to do 10 to 15 repetitions on each, but just making sure that you're not compensating, all right? So that's kind of range of motion assessment and exercise. Number 1 is just this lateral side to side bend, okay? Number 2 is you can put your hands out in front, okay? Keep your elbows straight and just try to do a trunk rotation all the way to one side. Now, when I do this, I really try to make sure that my feet are both flat, because when I go to the right, my right foot wants to lift up just a little bit, okay? You can't see that view, but sometimes if I go too far, my right foot really wants to, the instep wants to lift up. So I want you to make sure both feet are flat on the ground when you do this, okay? Arms are out straight. I'm going as far as I can to the right, and I can see some studs here in my up and coming weight room, and I can kind of point to see which stud I get to on that wall. And I look on this side and I'm pretty close. It's actually a little tighter for me on this left side compared to the right. So I try to find like a visual marker. I don't know if you can see it in the camera, but I have more range this way and a little tighter on this one. So I can't personally rotate as far to the left. Okay, and I just use my hands here kind of as a pointer, okay? And that way I can keep my elbow straight and I can really monitor like how far over am I able to go that way versus this one. I am able to get further back on this right side. So I have a little dysfunction going to my left side. So the exercise, or the corrective exercise for that, is that you can just put your arms out here, you can put them here, but we're just trying to work these twisty muscles across your obliques, again, to perform this action. Again, you should feel something around the stomach area, okay? So what's interesting is that both your external and your internal obliques work in combination. So you may feel something on both sides, but basically your external obliques run a little bit more like pockets, like they run in this orientation on both sides. And then your internal obliques run the opposite way, kind of like Christmas trees, like this, okay? So it means that the internal oblique works with the external oblique to perform this left rotation, okay? But you might feel just that lower one, you might feel this upper one, or you might feel them both together kind of working. Same thing with this one, right? The internal works with the external as you kind of fold or bring those together. And again, as you go to the right, you might feel just the lower one, you might feel just the upper one, or you might feel them working together. So that's why I'm saying you might feel a little bit on both sides as you do these twisting actions. So whether it's here, whether your arms are down, whether your arms are up, and you use that elbow to kind of drive back and forth, you should feel something kind of along these oblique lines allowing you to twist into those actions, okay? You really shouldn't feel too much into the glutes and stuff like that. We're really trying to focus again on these obliques inside of your ab muscles, okay? So that's exercise number 2, and again, 2 to 3 sets, 10 to 15 repetitions per side to try to wake up those muscles, okay? And the third one we're gonna look for is just a forward bend, almost like a standing ab crunch. So from this position, we're just trying to go all the way back. We're trying to feel this front 2 sets of lines of abs that go right here, okay? It's actually have an 8-pack, not just 6. There's actually 4 on each side that go all the way from just below your belly button to right up into your rib cage. What we're trying to do in this back extended position is stretch those out, and then from here we're going to try to contract those and just kind of crunch forward. So just like somebody punching you in the stomach, you're trying to kind of suck that in, and you should feel these front muscles kind of fold and contract as they pull your spine together. Okay, and when you go forward like this, you should feel contraction here. You should not feel your lower back get tight. If your lower back is feeling tight when you kind of crunch forward like this, it typically means one of these series of front ab muscles are disengaged and not working correctly. So here's more of a side view, right? So we're just kind of going all the way back into a standing motion like this, and you're just trying to kind of slouch, but kind of suck your stomach in and flex these front muscles as you round your back and come forward. So again, you can kind of extend, you can kind of see that little natural arch in my back, and I kind of flatten out that arch and then turn it the other direction by trying to flex these stomach muscles. So again, I'm kind of sucking in as I go into that. So again, I'm here, and then I can kind of pull in and fold down. So as I do that, if I'm not feeling equally left and right front muscles like this, I can just slightly turn one direction, okay? There I could feel mostly on my right side. Okay, when I turn to the left, I felt that a little more on my left side. So if you're not able to feel both in this neutral position, try just a slight angle and see if you can't get those front ab muscles to start to engage. So again, those are 3 kind of range of motion exercises and just kind of range of motion checks that you can do just kind of assess some of those trunk stability muscles that are in your midsection. So hopefully some of those will help. And if they don't, make sure you reach out, give me a shout, and we can try to figure out if there's something, again, higher or lower that's causing some of that dysfunction in the trunk and torso area.